Today's medical rounds. Hartford Hospital's heart transplant team recently reached a major milestone. It's performed 500 heart transplants. The transplant program continues to be recognized for its clinical outcomes and the number of transplants performed. And here to talk more about it is Dr. Andrew Feingold. He is the medical director of the heart transplant program at Hartford Hospital. Thank you so much for being with us, Doctor.
Oh, thank you. It's really an honor to be with you today.
500 heart transplants. That's a pretty significant milestone. Tell us a little bit more about how you achieved that.
This is really a huge accomplishment for the program. It really speaks to our rich history, where we performed the first cardiac transplant in Connecticut that was successful in 1984. The number of 500 could never be achieved unless we had a tremendous team behind it that worked incredibly hard over the years, over an extended period of time. The number 500 means we're able to give 500 new leases of life. I think about all the individual patients over the years whose life we saved, and we're able to take really great advantage of the opportunity of their gift of life.
And you still continued to perform the transplants during the pandemic. So tell us how you had to make that happen.
There's no question the COVID-19 pandemic created unique challenges for our program. We felt that was very important to continue to offer life-saving heart transplantation to our patients who really didn't have the luxury of time to wait for things were calmer. The challenge was that COVID-19 created much higher risk for our patients. We worked very closely with the hospital and our transplant infectious disease team to put in protocols to reduce their overall risk. Fortunately, I could sleep much better at night knowing that our patients now have access to the vaccine and their booster, which has really been crucial to reduce their risk from COVID-related complications.
Just real briefly, we don't have a lot of time left, but the transplant list, getting from that list to transplantation, can you tell us how you do that? Because I know that's a big struggle and you've made some accomplishments there.
Sure, and even improvements with technology and mechanical heart pumps, heart transplant still remains the gold standard treatment for patients with end-stage heart failure. Patients who have heart failure who progress despite their best treatments with medical therapy can be referred to our program for consideration for advanced heart therapies that include mechanical pumps and even heart transplantation. Once they're referred, our team does a comprehensive evaluation where we see if they would benefit from heart transplantation and do well. And once accepted, they get put on a list, and when an appropriate organ becomes available, based on their size, blood type, acuity, and their time on the wait list, then we move forward with the transplant operation.
Thank you, Doctor. We appreciate your time. For more information on the segment, go to the Channel 3 app. You'll find a link right there on the website. And ahead, an all-new Great Day at 3. Here's a look.